Hello friends, this is Sonu, and today I will continue discuss about the anti-anginal drug. In my previous videos, I discussed about the what is the angina, the types of the angina, and the differences between each other. So today we'll discuss about the mainly pharmacology, that which types of drugs belong to the anti-anginal drug. So let's talk about first of all the classification. We have different types of drug which use in the anti-anginal. The first drug, that is the nitrate. Actually, the we can say that nitrate is the typical drug or the drug of the choice for the anti-anginal, and the rest of the drug which are mentioned in the as an anti-anginal drug, it is the just like for the prophylaxis or maybe some of the side effects for prevention of the some of the side effects. So the first drug, that is the nitrate, and the second one, that is the beta blocker, you can see, and the third one, that is the calcium channel blocker, then potassium channel blocker, and some other miscellaneous drug. So mainly we start from the nitrate, because the nitrate is the we can say the nitrate is the as a main anti-anginal drug. That's why first we discuss about the nitrate, then we'll further move different types of classification. So the first drug, nitrate, is subdivided into two parts, that is short acting and long acting. In a short acting, that is very popular drug, which is the glycerol trinitrate or nitroglycerin, we can say glycerol trinitrate, or we can also write nitroglycerin, nitroglycerin. Then amyl nitrate. Actually, amyl nitrate is mainly used in the cyanide poisoning. Why we can use cyanide poisoning, we will discuss later. Why just trust that this drug is the also belong to the nitrate, and it is the more short acting than the glycerol nitrate. After that, long acting. In the long acting, we have four types of drug: isosorbide dinitrate, isosorbide mononitrate. So here there is no differences, just it's a dinitrate, and here is the mononitrate. So the rest of the name is same, so very easy to remember. Then erythritol tetranitrate, and here also just penta is the added here in different types. So penta erythritol tetranitrate, and the rest are the same. So erythritol tetranitrate and penta erythritol tetranitrate. So this drug is the mainly we can say that this is drug used mainly as an anti-anginal. So first we will discuss about details this all drug, then we'll move in a further different types of drug. So let's talk about first nitrate. So first we will discuss about the mainly the pharmacokinetic of the nitrate. Pharmacokinetic, because it's a very important. If any person with if occur the anginal attack will be occur on the time, which types of route of administration have to take or have to give. So the first is the sublingual. Sublingual. One thing also, first of all, let's write, then we can understand. This drug is the very highly lipid soluble. So it's a highly lipid soluble. And as we know that if drug is the very highly lipid soluble, so it can be very easily to absorb, easily to penetrate to blood-brain barrier and everywhere. That's why this drug is the highly lipid soluble. After that, we can give this drug, if we talk about the route of administration, so we can give this drug sublingually. Sublingual means in a buccal mucosa, they have to put on the buccal mucosa, and it will be very fastly absorbed and dissolve in the blood. Then of course we can give orally also, but orally, one bad thing about the orally, because this drug is the go in a highly fast metabolism. What is the fast metabolism? Means this drug will be first go in the stomach, it will be absorbed, then it will go in the liver, and liver will be metabolized, and after the metabolized, whatever amount of the drug, that is the action that can be perform the action. That's it will take more time, and here who is suffering from anginal attack need very fast drug. That's why orally drug we are mostly used for the chronic, or we can say prolonged users who suffering from chronic angina. On the time we can give orally, but in an instant case always we can give either sublingual, either intravenous. So next, intravenous. After that, even in a spray form, nowadays we are using a spray form. It is the more fast acting than the sublingual. After that, we have also transdermal patch. Transdermal patch means in a dermal patch we can give intradermal, so that is a transdermal patch. So these are the main route of administration that we can use: sublingual, orally, intravenous, a spray, and transdermal patch. But in which conditions these types of these types of route of administration we can use? Sublingual, most probably sublingually used for the acute conditions, or those patients who know about her health that they can attack in anywhere. So always they drug keep in the pocket, and whenever they feel that I have a start to pain, or maybe I will start my health will be become worse, on the time they will take sublingually. So always in this types of patient take sublingually. Next one, orally. Orally for those person who have chronic angina, means they can work or they can walk, they can live in a normal life, but maybe in extensive work or maybe extensive more severe stress, on the time pain can be occur, anginal pain can be occur. So for the preventive of those types of problem, they will take orally in a prolonged use. Next, intravenous. Actually intravenous use always in a very rare condition. For example, in a stable angina, if the stable angina is most probably 90% is a blockage, and after these conditions the angina will attack, on the time we can give intravenous, but this route of administration always used in a hospital most probably. Then unstable angina. Actually in unstable angina, you can remember or you can watch my previous video that in an unstable angina is the almost blockage of the all arteries due to the aggregation, due to the platelet aggregation. That's why on the time we can give intravenous. So very rare conditions we can give. And a spray just like the sublingual, but is more fast than the sublingual. And then the transdermal patch, it also like the intravenous. If the person anginal attack pain occur, or they are in a unconscious conditions, on the time we can give transdermal patch. Or maybe those conditions doctor will not finding veins, or they will not able to inject the intravenous, then a transdermal patch will be give. So these are the main route of administration that is very important to know. Okay, now let's talk about other thing. So highly lipid soluble we can give by this route. Why we cannot give always orally? Because due to the first metabolism. So now let's talk about that how this drug will work, or we can say in a medical term pharmacodynamic. So now we'll discuss about the pharmacodynamic. First of all, let's make your heart. So this is the heart. It's not good diagram, but you can understand. This is the superior vena cava, inferior vena cava, and here this is the aorta. Obviously, here is the carotid artery. So these are the left ventricle, sorry, right ventricle. Here is the left ventricle, and left atrium and right atrium. So you can very easy to understand that from the right atrium, I mean the from the inferior vena cava and superior vena cava, all venous blood will come in the right atrium, and the right atrium will go in the right ventricle, and in the right ventricle it will go in the lungs, and then from the left atrium to left ventricle blood will come, and they will pump by the aortic valve. So these are the main normal physiological conditions. And now how the nitroglycerin will be work. So let's talk about that. For example, this is the coronary arteries, and here is the plaque formation, stable plaque formation, or classical angina. I'm talking about the classical angina first of all. Here is the plaque formation. So now heart is working normally, but for the even in normal work, it need more oxygen and more blood. Why? Because the plaque accumulation here and blood become very slow. So now the heart is suffering from ischemia, because it's ischemic condition heart due to less blood flow. So now we have to do that in somehow we have to decrease the, or we have to reduce the, or we have to decrease the contractility of the heart in any conditions. Then in a this even in this plaque also heart can be work normally. If we will decrease the heart rate, we will reduce the cardiac output or cardiac work. Then in a plaque formation, along with the plaque formation, they can live normally. So how we can decrease this cardiac output? So first we have to decrease the blood, whatever blood they coming in the from the inferior vena cava and superior vena cava, those blood we have to decrease. And how we can decrease this blood? If we will dilate this artery, we will dilate the vessels, vein vessels. So by the dilation, if we will dilate the vessels, means whatever blood is coming in the heart, they obviously they will decrease. And if whatever blood will come from the right atrium to the right ventricle, the same blood will go in the lungs for the the oxygenated, and those blood will come in the left ventricle from the left atrium. So if we decrease the venous return, so obviously decrease the blood, and whatever blood is coming, so for example the normal blood is the 5 liter in normal conditions, but for the reduction, for the need, because the heart is suffering from ischemia, so we have to decrease the cardiac contractility, cardiac output. So for example, if we will dilate the vessels, so now blood is coming, for example, just hypothetically think 3 liter. Before it's pumping in one cardiac systole, in a stroke volume, or we can say one cardiac contraction 5 liter. Now is contracting or they pumping 3 liter, means automatically they decrease the heart rate, because now it's a less blood is the pumping. And as we know that if the less blood will come in the left ventricle, it will less contract. From the Frank Standing law, from the physiology, they said that if the more blood will come in left ventricle, it will more stress, and it will more stress means the left ventricle will more stress, so it will more pump, and the cardiac output is the more, so the cardiac function will more. And if blood will if from the left ventricle in the left, the left atrium in the left ventricle will blood will come less, so it will less stress and it will less work. So automatically heart will less contract, it will less work, and even in a stenosis formation, even in a plaque formation, they can be managed by the less work. That's why we use nitrate. So the nitrate will dilate the vessels, or in some conditions, in some amount of also dilate the arteries. So we can say preload and afterload both can be decreased. Mostly preload is decreased, most probably. mostly, and some percent also dilate the artery. So preload and afterload, the both can be decreased, and the both decreasing can be decrease the cardiac work, cardiac output, cardiac contractility, and then it can lead to, even in a less blood, it decrease the oxygen consumption. And if the decrease the oxygen consumption, so automatically pain become disappear. So these are the main pharmacodynamic, that how the nitroglycerin work and how the pain become disappear. Because if we will decrease the cardiac output, automatically in a, even in a less blood, cardiac can be live normally, cardiac can be work normally if they decrease the cardiac output. So these are the main mechanism that how it's working. Now we'll discuss about that what is the main mechanism of the dilation, how it can be dilated, how the the nitrate will go in the muscles, vessels muscles, and why the it's dilated veins than the artery. What is the main mechanism? So let's talk about this thing. So let's make your veins. This is the vein, and here is the smooth muscles of the veins. This is the smooth muscles. Let's take, I will make a bigger one here. So this is the bigger one of the one cell, one smooth muscles. As we know that for the contraction, always we need calcium. Without calcium, any muscles cannot be contract. So obviously, this is the calcium channel. We'll not discuss here action potential, that first way a cell become depolarized, so sodium potassium channel will open, then calcium channel will be open. So you can understand here very easily. So now the calcium from the extracellular to the intracellular, calcium is come. And within the cell, we have endoplasmic reticulum. So in the endoplasmic reticulum, within the muscle cell also synthesize the calcium, store the calcium. So let's talk about that. Here is the storage of the calcium. First I am discussing about the normal physiological contraction. Then we'll discuss about the how nitrate will go and bind. So this is the calcium, and calcium will bind to calmodulin. And this two molecule is make complex, calcium and calmodulin. And this calcium and calmodulin will activate the myosin light kinase. Myosin light chain kinase. So by the help of calcium and calmodulin, it's activate the myosin light kinase, and then myosin light kinase will work on the, let's talk about, this is the actin and myosin. So as we know that whenever muscles become contract, so actin myosin will attract each other and muscles become contract. This is the normal physiological functions. So the same thing here, myosin light kinase will be phosphorylate the it's act on the myosin and actin and myosin. It's activate the actin and myosin, and then muscles become contract. So we can say that this molecule is a phosphorylate, and then actin and myosin will attract each other, and muscles become contract. So these are the normal physiological conditions, that how the muscles become contract. Now we'll discuss about that how nitrate will come here and bind and dilate or inhibit the contraction function. So the person will take nitrate will come inside the cell, because it's a lipid soluble, so very easy to penetrate because this cell also made by the lipid bilayer, so that's why it's very easy to go inside from the extra to intra. So nitrate will reach now in the cell, and now the nitrate will convert in the nitric oxide. In a general anesthesia, you can heard about nitrous oxide. That is the for the general anesthesia. It is the gaseous general anesthesia. So don't confuse with it. It is a nitric oxide. NITRIC, nitric oxide. So from the nitrate is the drug, I mean glycerol nitrate. So from the glycerol nitrate, it converts in the nitric oxide. And as we know that nitric oxide will always dilate over the smooth muscles. But how it's a convert from the nitric to nitric oxide? So there is the enzyme. This enzyme name is the mitochondrial aldehyde dehydrogenase. So mitochondrial aldehyde dehydrogenase, this enzyme will help in the from converting to nitrate to the nitric oxide. And this enzyme is the mostly or abundantly found in the vessels of smooth muscles than the arterial smooth muscle. Due to this reason, the nitrate, all nitrate drug is the dilated vein than the artery. Due to this reason, because this enzyme is the mainly most probably found in the venous smooth muscles, venous side smooth muscles than the artery smooth muscle. Due to this reason, it dilates more veins than the artery. So now it's a nitric oxide will be formed here due to this help of this enzyme. And now the nitric oxide, let's make bigger than. So okay, so now nitric oxide will be activate the cytosolic guanylyl cyclase. So nitric oxide will be activate the cytosolic guanylyl cyclase, and then the cytosolic guanylyl cyclase by the help of guanosine triphosphate. Triphosphate will convert in the cyclic guanosine monophosphate. As you remember, in some other cells like some other smooth muscle cell and some different types of cell have adenylyl cyclase, cytosolic adenylyl cyclase. So adenylyl cyclase need for the conversion ADP to ATP, but here is the cytosolic guanylyl cyclase. Due to this reason, here is need guanosine triphosphate to the cyclic guanosine monophosphate, and then guanosine monophosphate will bind to the protein kinase G, and the protein kinase G will be inhibit this all myosin light kinase function. So we can say the protein kinase G is the dephosphorylated of the myosin light kinase chain, and if the myosin light chain kinase will be inhibit or interrupt, then it will not phosphorylate the actin myosin, and muscles become cannot be contract, and due to this reason dilation will be occur. The first function. Second function, it will go in the cell membrane and also inhibit or decrease the calcium entry from the extracellular to intercellular. So there are two functions. First, it's a main function that is the blocking or inhibiting the function of the myosin light chain kinase, or we can say it's a dephosphorylation by the help of protein kinase G. It's a dephosphorylation of the myosin light kinase chain kinase functions, and other side it's also decreasing the entry of the from extracellular to the intercellular calcium ion. So calcium gate will be blocking the calcium gate. So by the two function, they lead to dilation of the smooth muscles, because the smooth muscles cannot be contract and vessels become dilated. So these are the main mechanism that how nitric oxide work here. Now we'll discuss about that guanosine triphosphate to the cytosolic guanosine monophosphate. Now we'll discuss about that indication, that in which conditions we can use and which types of angina. Why the veins is a more dilation? I told you, due to the enzyme mitochondrial aldehyde dehydrogenase. This enzyme is the more found in the venous smooth muscles than the artery due to this region. So let's talk about indication. First indication, obviously, angina. But which types? A stable angina and variant, or we can say unstable. But it's a most probably work in the well in a stable angina. In a variant or unstable angina, due to the completely blockage, so in these conditions, if the person will take orally, it will not much helpful. So in these conditions, always should be given by the intravenous or transdermal patch. But in this condition, need hospital, because on that area where is the attack is occur, we cannot give as a fast aid. We fast aid as a we can use by the sublingually. So and this thing helpful for the stable angina, not for the unstable angina. But if we will give an intravenously, so it will dilate more and more venous. That's why we need in a hospitals. Then, apart from angina, in which conditions we can use this drug also? This drug we can also use in a congestive heart failure or acute left ventricle failure. Why we can use these conditions? As we know that if the acute left ventricle failure occur, so heart is the mainly pump blood in the left ventricle. So if we give the angina, so obviously decrease the preload, like the I told you about the mechanism, that pharmacodynamic, that how decrease the blood flow. So the same thing, if any person have acute left ventricle failure, if we decrease the preload and afterload, obviously the left ventricle will work very less. So on the time, person will feel better, or we can prevent the further myocardial infarction. So also we can use in MI, myocardial infarction. We can say that prevent to the further myocardial infarction. So we can use this drug, and we can use in a esophageal spasm. Esophageal spasm. Esophageal spasm. Actually, this drug is the relax the spasm. Esophageal spasm is relaxed, and then can be a relief for the person with esophageal spasm, because it's a decrease, or we can say reduce the esophageal tone, and then esophageal spasm will be a relief or decrease. Then cyanide poisoning. Cyanide poisoning. Why we can use in a cyanide poisoning? So let's talk about first of all cyanide poisoning. Actually, whenever glyceryl nitrate will take the person, the hemoglobin will convert to methemoglobin. 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 And from the hemoglobin, it will convert into the methemoglobin by the nitroglycerin, glyceryl nitrate. And whenever methemoglobin will be converting in these conditions, the cyanide radical is the more tendency to bind to the methemoglobin. So here cyanide will bind more and more. Cyanide will bind, and it become cyanomet hemoglobin. Hemoglobin. But in these conditions, we have to add some other molecule, some other drug, that is the sodium thiosulfate. So sodium thiosulfate we have to add approximately 50 gram, 50 I think mg. So sodium thiosulfate will be added, and after that it become met hemoglobin plus sodium cyanothiosulfate. So from the hemoglobin, by the help of glycerol nitrate, it become met hemoglobin, and then the met hemoglobin will whenever the hemoglobin will go in these conditions, the cyanide radical is a very highly tendency to bind. So now it's a bind to the cyanide, so cyano-met hemoglobin will be formed, and then whenever the cyano-met hemoglobin will be formed, we have to need another molecule, another drug, that is the sodium thiosulfate. So sodium thiosulfate will be, it's break down two part, met hemoglobin plus sodium cyanothiosulfate, and then this molecule by the urine it will be go out, so excrete. So by this way we can treat to the cyanide poisoning, but this is the no drug of the choice, or we can say control of the cyanide poisoning. Obviously we have to give antidote also, specific antidote, but we can control or somehow we can manage those time or those conditions. But this nitrate is the mainly for the angina, but we have to know that esophageal spasm and cyanide poisoning, that is the we can say alternate indications. So these are the main about the indication. Now let's talk about the side effects, and then how we can manage the side effects by the help of some other drug. Side effects. The first side effect is the headache. Means we can say that if the person will take glycerol nitrate and start headache, so we can say that drug is a start producing action. Why the headache? Actually due to dilation of the lot of vessels. So the one of the vessels also present in the CNS, central nervous system, that is the meningeal artery. So if they decrease the meningeal vessels in the dura mater, so let's talk about that. This is the vessels, and this is the brains, and this is the vessels. So if we dilate this vessel, so here is the lot of pain receptor in this area. So if they dilate this vessel, so these vessels will press this pain area, this pain receptor, or stimulate this pain receptor. That's why the pain become occur, or pain headache will be occur due to this reason. Next one is the flushing in the skin, in a face or in the skin also. Why? Due to dilation of the facial artery, dilation of the facial vessels, and in a skin vessels also dilation, that way. That's why flushing in a face or rash can be appear. Then postural hypotension. What is the postural hypotension, or orthostatic hypotension also we can say? Actually postural hypotension, it is the whenever the person will lying position or sitting position, they suddenly stand. So due to the gravity, the blood is the very gradually lost, like the all blood is going in the lower extremities due to the gravity. If they in a lying position or sitting position, they suddenly wake up or suddenly stand. Due to this reason, the less blood will go in the brain area, and the cardiac output automatically less, because the less blood is coming in the venous sides, the venous return, and that can lead to, if due to the less blood is coming, or due to the less blood is going in the brain area, and it can lead to the fainting, it can lead to the suddenly fatigue or suddenly dizziness, and this all thing is called postural hypotension. So for the prevent the postural hypotension, actually, as we know that in a normal persons, even like us, if I will as sitting in 1 hour or sleeping in 1 hour, and suddenly if I will stand, so maybe I also can lead to the postural hypotension. Can I also suffer from the postural hypotension? It is the normal physiological. But those person who are taking nitrate, so obviously nitrate will directing the all vessels. So on those conditions or those persons have more tendency or more chance to the create or occur the postural hypotension or orthostatic hypotension. That's why it's very important. So in these conditions, how we can prevent this problem? Either we should take this in a lying position, I mean in a lying position, or in a sitting position. That's why those person who is a prolonged use due to the they suffer from chronic angina. So this drug always we should give in a night time, because they will take the drug, and the person will sleep. So they will not occur postural hypotension. That's why lying position, sitting position can be, by this method we can prevent the postural hypotension. After that, dependence or withdrawal syndrome. Dependence can be occur. What is the dependence or withdrawal syndrome? It means that if the person is taking nitroglycerin very regular basis, or we can say due to the chronic angina, and suddenly they stop the angina, I mean suddenly they stop taking the glyceryl nitrate or any nitrate drug, so they maybe or most probably start the attack of the angina. So don't be leave, or don't be we can say uh, leave the nitroglycerin or any nitrate drug very fastly. It should be leave very gradually. Means, for example, the person is taking from 1 month, and suddenly stop they stop any nitrate drug. Then what you can feel or what you can see, the attack of the angina will occur. Attack of the angina may be very fast, and they can lead to even sometime death, or sometime myocardial infarction can be occur. That's why very gradually we have to leave they have to leave the drug, or they have to stop the taking drug. So very gradually, maybe they're taking 4 times a day, so in next day 3 times a day, 2 times a day, then one time a day, like that we can like the person should be leave, or person should be take this drug. If otherwise, dependence or withdrawal syndrome can be occur. That's why it's also very important to know. Next one is the tolerance. This is the very important side effects, we can say. Tolerance. What is the tolerance? Actual tolerance, if the person is the but it's a very rare conditions, and those persons or those patients who are taking nitroglycerin in a very very fastly way, means they are taking by the sublingually, transdermal patch, in intravenous, in one time, or maybe very regular basis. So on the time, what you will see to the patient, that the drug efficacy become low. So if for example they're taking 5 times a day, so maybe after 1 or 2 days they have to take 8 times a day or 10 times a day. Why? Because in a 5 time a day, there is not drug efficacy is not well like the previous. Means if I will start today, from today I will start taking the nitroglycerin. So today is working well. If I will take the 5 times a day tablet of the nitroglycerin or sublingually, they're well working. My pain is the absolutely disappear. But maybe after tomorrow or after day of tomorrow, even in a 5 day, I also some like pain is appear. So if I will take 6 times a day or 7 times a day, then my pain become disappear. So we can say that if the regular usage, the drug efficacy become low. That's why the nitrate free interval have to give. So approximately in every day 8 to 10 hours should be prevent or should be avoid the nitrate. So that's why in a night time they take the nitrate, and then in the morning then the nitrate will take. So approximately 8 to 10 hour or 12 hour should be avoid or should be nitrate free interval they have to take. So that's why it's a tolerance effects. It's also very important. Next one, the reflexive tachycardia. Reflexive tachycardia. Reflexive tachycardia or reflexive sympathetic stimulation, the same like postural hypotension. Why the? Because as we note in the this is the carotid sinus. So in the carotid sinus, a baroreceptor is there. So if the person will take more than a normal dose nitrate in any of the nitrate, so if they will increase the amount, if the concentration of the nitrate is more, so it will dilate the more vessels. It's very easy. So it will take the more nitrate, it will dilate more vessels, and more cardiac output will be decreased. So when what cardiac output will be decreased, so as a compensatory mechanism to the compensate, baroreceptor will be fired, baroreceptor will be stimulated, and this receptor will go in the our medulla oblongata, and in the medulla oblongata it will stimulate the vasomotor center, and the vasomotor center will stimulate the sympathetic stimulation. So whenever sympathetic stimulation will be occur or it will be stimulate, so obviously it will release all catecholamine like noradrenaline and adrenaline. This also belong to the catecholamine. So and this two will go and work to the receptor, and then suddenly cardiac output will be increased, tachycardia will be occur, and it can lead to sometime even patient can be die who is suffering from angina, or maybe patient can be going unconscious. That's why for the preventing of the reflexive tachycardia, always we should apply either lying position, either sitting position should be give to the patient who suffer from angina to the prevent reflexive tachycardia and postural hypotension. So these are the main important side effects. Some other side effects like the fainting, sometimes vomiting also, and sometimes also we can say unpleasant feel, palpitation can be occur. Palpitation means the you can palpate the heart, or we can say it's a unpleasant awareness of the cardiac. Like that side effects can be occur, but these are the main side effects. And one side effect also I forget to mention, that is the sometimes say Monday disease. What is the Monday disease? Actually, this disease is not for the patient or not for the who suffering from angina. This disease is only mainly occur in the those person who is working in the pharmaceutical company, and this company they are making nitrate tablet or any nitrate form, either a spray form or any synthesis of the nitric, artificial synthetic of the nitric. So for example, from Monday till Friday, because Sunday Saturday is the holiday, so Monday till Friday they're working in the pharmaceutical company, and they're synthesizing or they're artificially making the nitrate. And as we know that if the person contact the nitrate either in a spray form, either in a injection form or tablet form, it regularly, so tolerance can be developed. Tolerance means the drug efficacy become low. So those person who working in the pharmaceutical company from Monday till Friday, they will not affect more, because they are working in the same way in the same factory. So the nitrate become tolerance will be developed, because they are working in a 24, I mean the 12 hour in the same places where is the nitrate is the making or nitrate is the synthesizing. That's where tolerance will be developed. But after Sunday and Saturday and Sunday in the holiday, they went home, and in the home is not any contact with the nitrate. So obviously tolerance will be disappear, because in 48 hour have no any contact with the nitric. And then again in a Monday the person will go in the factory, pharmaceutical company factory, where the nitrate is the synthesizing or artificially the making. So suddenly they start headache, because they from the Sunday, from the after the 48 hour they contact with the nitrate in any molecule of the nitrate. So again they will start headache, and sometime flushing of the rash, and flushing of the face and skin rash and headache can be developed. That's why the name is the Monday disease, because every Monday the person will go in any factory after 48 hour, means it's too big gap. That's why Monday disease, the name is the Monday disease. So but this side effect is the for the normal persons who's working in the pharmaceutical company. For the patient is not uh, significantly. For the patient these are the mainly significantly. So I think this is all information about the nitrate. Now we'll discuss about that how we can combine this drug. So for example, in a postural hypotension and or we can say reflexive tachycardia, means for example if any person was suddenly attacked of the angina, so on the time you will not able to do like the person have to give in a night because of the postural hypotension, so we cannot give right now. If we will not give right now, the person will die or person will have myocardial infarction. So for the prevention of the those conditions, we should add beta blocker. What did the beta blocker? Beta blocker will be inhibit the beta 1 blocker which are situated in the heart area. So if the tachycardia will be occur, so beta blocker, if we will give the beta blocker specific selective beta blocker drug, so tachycardia will be automatically prevented. So reflexive tachycardia, obviously sympathetic stimulation will be occur, noradrenaline will be occur. But if we will block the receptor, so the noradrenaline adrenaline will cannot be bind the beta 1, and if the node will bind, so beta 1 will not stimulate and reflexive tachycardia automatically will be prevented. By this way we can prevent. In calcium channel blocker, in which condition we can give the calcium channel blocker? Let's talk about calcium channel blocker. As we know that for the contraction of the muscles we need calcium channel blocker. So for example, vasospastic angina, vasospastic or Prince metal angina. Actually in these conditions what? This is the artery. So a spastic of the artery. So if we will give the calcium channel blocker, so it will be dilate the artery, and in some how the blood become pass in this area due to dilation, and can be it's better for the person or patient. So by this way we can use calcium channel blocker. So these all information about the nitrate, that in the right now we have to discussing the nitrate. That's why we have to know about everything about the nitrate. In next videos we will discuss about the separately beta blocker, calcium channel blocker and potassium channel blocker, some other miscellaneous drug. But once again I would like to say that nitrate is the drug of the choice for the as an anti-anginal drug. Whenever any angina will occur, always doctor first drug will give the any kind of the nitric, most probably glycerol nitrate. Then will further for the chronic angina will we can give long acting, that isosorbide dinitrate, isosorbide mononitrate, then erythritol tetranitrate and pentaerythritol tetranitrate. And one thing also I have to mention about the isosorbide mononitrate. This drug, even in this all drug, if we will give sublingually or intravenous, they will start work very fastly. But if we will giving the orally, the all drug will be, working as slow. So isosorbide mononitrate, these are the one of the drug we can give orally. So this drug mostly the person, or we can say we are giving the most probably orally, and the rest of the drug can be give intravenous and transdermal also. And one thing also I have to say that if you giving the nitrate, this drug start action within 2 minutes, within 2 to 3 minutes. So if for example any person attack, the angina attack will occur. So if you give the nitrate within 2 minutes, if the person will not pain become disappear, again you will repeat. So if you give 5 tablet or 5 time, if in a 5 time, if you give the 5 time and then nitrate will not the pain become not disappear, then you have to think the person have unstable angina. It is not permanent or absolutely diagnosis of the unstable, but you can suspect that because in a stable angina the plaque formation in a particular area. So obviously even in 90% plaque is the form, even 90% somehow if the person in a resting position, so pain should be disappear if the in a unstable angina. But in a, a stable angina, sorry, but in a unstable angina, unstable means the completely blockage of the artery. On these conditions, pain should be not disappear because due to the completely blockage. So on those conditions, if the pain is not disappearing, so we can suspect that the person have unstable angina, and immediate they have to send the hospitals, because in hospitals they start intravenous nitrate, and any of the nitrate, mostly glycerol nitrate. And if you give the intravenous, then more and more vessels become dilated because it's a very fast working. And after that, start the surgery like the bypass, angiography, a stent have to means put on the particular area, or some other types of surgery. But it's a very rare conditions, very rare cases. So that's why this information have to know also. Means within 2 and 3 minutes will start not work, then you can suspect that the very serious severe conditions, and immediate they have to have to send the hospitals. So this all information about the nitrate. In next part we will discuss about the very briefly, because beta blocker, as we know that already we discussed about the adrenergic antagonist, sorry. Calcium channel blocker is the antihypertensive drug. So we will discuss about the calcium channel blocker and the potassium channel blocker also, and then some other drug also. So thank you. In next video, in next part we will discuss all those drugs. So thank you.